Facebook and YouTube Live. It's been about 3 weeks since I have done a Facebook Live, and I was in Kentucky last week in Louisville for the NLN Kentucky Spring Conference. I was a vendor for Keith RN, and I want you to know, if you live in Kentucky, I was asked to be the keynote presenter for the fall NLN conference in Louisville at Galen College. And so if you're in that state, I'm looking forward to returning. It's a little warmer than Minnesota and a beautiful state. So if you're checking this Facebook Live out for the first time, the goal of this live stream is to support and serve the needs of nurse educators in the trenches and empower you with practical strategies to better prepare students for both practice and licensure, and developing those clinical judgment skills that are essential for not only practice, but also the upcoming next gen NCLEX. And so if you're out there tonight, give me a shout out in the chat. Let me know who you are, what state you're from, and where you're making a difference in nursing education, because, you're here for a reason. And, it's my goal to just give you the information as we talk about some of the specific the skills of clinical reasoning and what that looks like. And we're going to be talking about the specific skill, the very first step in Tanner's clinical judgment model of noticing and what that looks like. But if we've never met, my name is Keith. I'm the founder of Keith RN. And what I do with Keith RN is just create resources to lead the needed change in nursing education. And so my why is to transform nursing education. When you look at Pat Benner's work from Educating Nurses, I read this as a brand new educator 12 years ago. And the paradigm shifts that we need to embrace to transform how we teach, because it all comes down to patient outcomes and practice readiness. But we need to contextualize our content to the bedside of practice. We need to bring clinical and class together. And according to the final paradigm shift was we need to emphasize clinical reasoning in nursing education. And Dr. Benner and her colleagues said this 12 years ago. So it is as timely as ever. If you haven't purchased that book yet, it's still on Amazon. I encourage you to check it out. And so just want to thank you all for joining me. JB from Alabama, Rhonda from South Carolina, Ashley in Oklahoma, Sarah in Kansas, and Leona in Texas, and Nicole in Illinois, and Julie from Arkansas, Carol in Chicago. I think we've got kind of coast to coast covered, and what a blessing it is, and everybody in between. As you know, I'm coming from Minnesota here in Andover, a suburb of the Twin Cities, and so it's a pleasure to be here. But one of the things I want to simplify for you as educators, as we look at how do we transform nursing education, it's putting practice first. 2 words that will change everything and how you teach and how we can strengthen. Because what we need to do is basically, as we look at practice, we need to embrace educational best practices. And that's what Dr. Benner and her colleagues wrote 12 years ago. And those simple paradigm shifts that are actually hard to do because change is difficult. But also we need to put practice first. And that's basically preparing our students for real world practice by embracing educational best practices. And so we're going to talk about how we can really create a new paradigm shift to really strengthen and transform so our students are well prepared for both practice and NCLEX. And it's kind of like putting on a new set of glasses, because for many of us, we've been putting the NCLEX first, if we're honest and reflect upon really what's wagging the dog in our program. And I get it. But we can do both at the same time, and I'm going to show you how today. And so as we look at one just quick announcement I wanted to share with you that I'm really excited about is that I have launched another Facebook group with another colleague by the name of Martha Johnson. And it is a Facebook group that just went live yesterday, and it's simply called Nurse Educator Entrepreneurs. And what I've realized, I didn't really realize I was an entrepreneur when I began my journey with Keith RN 10 years ago, just writing case studies from my lens of practice, helping to just bring those practice realities that Dr. Benner talked about. Clinical reasoning, contextualizing your content, nothing better than a good case study. But I'm not the only one with a great idea. And many of you have got a splinter in your brain, an idea, a book, a project, something that you'd like to take to market, because I am convinced that the innovation and that is needed to transform nursing education is not going to come from the top down, from the big companies that serve educators. They can help, but the true innovation, those that are willing to take risks and do it differently, like myself, it's going to come from the bottom up. And what I mean from the bottom up are educators such as yourself in the trenches who see firsthand the needs. And so if you have any questions or comments, you know what, post them in the Facebook group, and I hope to connect with you there with myself and Martha. Now, 3 weeks ago, we did a Facebook Live on clinical reasoning, and we talked about some of the principles from my third volume in my student textbook that just came out last week, or actually it's about 3 weeks now, Developing Clinical Judgment for Professional Practice. And I talked about the big picture of clinical reasoning, because as we look at clinical reasoning and how do we develop clinical judgment, it comes when we understand a very simple equation of 1 + 1 = 2. And how it works in nursing education, it's really simple. Critical thinking plus clinical reasoning equals the outcome of the correct clinical judgment. Now, it's a simple equation, but relatively complex, but I'm going to break it down in just 1 or 2 minutes. Critical thinking is, in essence, Potter and Perry's definition, is the ability of the nurse to think clearly, precisely, and accurately, and to act on what you know and understand. That simple principle of understanding essential content is the essence of critical thinking. Do your students understand the knowledge you're teaching them, or are they just memorizing it to pass the test? You see, critical thinking takes place in the classroom, and that's why we must make sure our students get that deep knowledge of what's most important. So it's a 1-2 punch. Critical thinking, our students must know and understand their knowledge that we're teaching them. But then secondly, clinical reasoning needs to be defined, because that's the other half of the equation. That's the ability to think in action and reason as a situation changes at the bedside. And a nurse uses that skill in the clinical setting or simulation, or if you're bringing case-based scenarios into your content in your classroom, you can practice it there as well. That's what my unfolding case studies have been doing for years. But the bottom line is this: we need to do both. Understand the knowledge, make sure our students understand, practice clinical reasoning skills, and that leads to the outcome of a clinical judgment, which can't be taught directly. You see, there's no shortcut to developing clinical judgment. And so we must really, it requires us to truly transform the way we teach nursing, making learning active, teaching less, and going deeper with what's most important, for example. And so I've been talking about this for quite some time, and many of you who've been following me are familiar with my strategies and principles that I've been sharing. So I'm not going to go deep there today, but I want you to know that if you would like to kind of dig and go into some of the things that I've shared in prior Facebook Lives in these 45-hour sessions that we have, or my YouTube channel that has actually some very concise 3 and 5 minute videos, my channel is right there. Subscribe. And every Facebook Live that I've done the last 2 years lives on my YouTube channel. You can easily access it and you can review it. More importantly, share the link if you find it helpful. And I also want you to know that another resource that I just want to share before I get started tonight is that I am the admin for a Facebook group called Teachers Transforming Nursing Education. I am so proud of this incredible group of almost 12,000 nurse educators that continues to grow. And it's a closed group, but it's a supportive community. So many of you are struggling, have some questions, have things that are just like, that you'd like to kind of just need some support or need some guidance, or download some free materials. There are dozens of handouts on this website. If you're not a member, please check it out and see what you think. And I know you'll find it really helpful. But, as we look at clinical judgment, I want to give you a big picture. We need to develop it holistically in nursing education. This mantra of think like a nurse isn't really, it's a starting point, but holistic clinical judgment is kind of a term that I coined because it's very comparable to holistic care. As you know, a nurse doesn't just care for the body. We care for the emotional and the spiritual needs of our patients. And in the same way, holistic clinical judgment is recognizing that in order to think like a nurse, you need to care like a nurse, and you need to develop the holistic care of spiritual care, the caring, compassion, presence, engagement, professionalism, and professional behavior. Secondly, we need to develop the knowledge of practice, and we need to develop, again, the understanding what's most important of our knowledge. And the third component is the clinical reasoning skills, the specific skills. Clinical reasoning is a big picture construct like the nursing process. But just as the nursing process is one clinical reasoning framework that a nurse uses to break it down with assessment, analysis, etc., the primary reasoning framework that nurses use has been identified by Chris Tanner and her clinical judgment model. And what I want you to show, what I want to just reveal and show in this infographic to really make it visible to you, this is an ATI infographic I've been given permission to use. And what this does is shows the alignment that when you look at the assessment of nursing process, the noticing skill, Tanner is the outer ring of noticing, interpreting the data, responding, reflecting. And the nursing process is the middle ring, practice-based framework. The next gen framework is in the middle, very inner circle, and all of these processes align because the NGN model wasn't invented. They derived it from Chris Tanner's framework that was a synthesis of almost 200 articles in the nursing literature published in 2006. And just Google the term thinking like a nurse, Chris Tanner. You can download the PDF right now. I thought I had the link, but I don't have it in front of me here. And so go to that. And the bottom line is that this framework, Tanner's framework, was derived from practice. The next gen framework is a test framework that has no research to inform it as a practice-based framework. Our students don't need to know the next gen framework. I know that sounds counterintuitive, but it's what the NCSBN has clearly communicated. They have made it very clear that we are teaching a practice-based profession, use practice-based frameworks that include the nursing process, and Tanner's clinical judgment model is a practice-based framework. We use it to guide and teach our students to inform practice. Use the NCSBN model to write your test questions, but they don't need to be taught to students. It's for faculty. And I just want to make that very clear and put that together. But again, as you look at this infographic, remember that noticing, the very first step of Tanner's framework, aligns with assessment of nursing process, which is as you're assessing your patient, for example, collecting data. The noticing skill of Tanner's framework takes that clinical reasoning to the next level of saying, what do you notice that's most important or most concerning? There's interpreting skills as the next step. What does it mean? Responding is the plan of care. How is the nurse now going to respond? By creating the nursing priority and the plan of care, and evaluative reflecting is the next step. And so what we're going to focus on today is the noticing skill of clinical reasoning. It's the first step of the nursing process that aligns with Tanner's framework, assessment, and also, by the way, recognized cues is the next gen, the way that they describe it. And again, they all are in essence saying the same thing, but it's saying it differently. And assessment and noticing are those nuanced skills. And what I'm going to do is that one of the things that I've written, and it's been a 1.5 year journey of love, is that I've written a student textbook series, and volume 3 is what we're going to focus on today. The 3rd chapter is on noticing skills. I'm going to highlight that in the book, and we're going to just kind of go through chapter 3 to help you see the value and just the simplicity so that you understand noticing skills and can be able to put that together for your students. And so the book is written for students, but yet faculty will also benefit from it. And I just want to kind of show you the essence of what's there and just kind of scroll through it together. So what I'm going to do is just do a simple screen share. And you can see, whoops, let me take off the infographic of ATI. We don't need that anymore. And so what I want you to see here is that what I'm going to start with is just kind of showing you the table of contents from volume 3 that goes deep on clinical judgment. Because what I'm going to be starting with, I talked 3 weeks ago about clinical reasoning skills. Today I'll be talking about developing noticing skills. I then go into the next step of Tanner's with interpreting skills, problem recognition, planning and prioritization, evaluation and reflection, talking about put it all together with a case study, improving outcomes, and looking at failure to rescue, as well as preparing for practice and transitioning with multiple patients, time management with a large assignment, those practical skills that a student needs to really be prepared for both practice as well as licensure. And so what we're going to do is just kind of skip ahead here to page 29 of the textbook. And what I just want to kind of start with is as we look at noticing, we can evaluate noticing in the clinical setting by identifying a very simple outcome, hold our students accountable to in our clinical evaluation and paperwork is this really simple statement: to collect, then recognize the most important clinical data. You know, in your clinical paperwork, are you asking those questions such as, what clinical data do you notice that's most important? Or what did you notice that was unexpected or expected in your patient? You see, if we're asking the right questions, we can identify if our students are able to really understand and are embracing the essence of noticing in practice. And so in order to get to noticing, these components of noticing are kind of like a holistic aspect of going deeper on the skill of noticing. And so, for example, what we want to do with this is, in essence, as we look at essential knowledge, when you look at noticing, what do you really need to know? Well, they need to understand essential content. Your students also need to know pathophysiology and the understanding of these foundational pathophysiology concepts in order to apply that knowledge to the bedside of patient care where it matters most. So that's why the knowledge is so important. If our students don't have the understanding, they are unable to use the knowledge at the bedside. They'll be unable to really notice consistently, because failure to rescue as a nurse is really a failure to not notice what's most important and then to recognize or interpret its significance. So this is the first step. It's foundational. If they miss noticing, the clinical judgment that's an outcome will not be met. They will not make the right decision. They will miss, and that patient will continue to go in a bad trajectory if a complication has developed. And so the next piece that's essential is to look at the clinical skills that we want to assess of a noticing skill. So I want to kind of give you a vision to say that clinical reasoning is like the big bucket. But we break down clinical reasoning when we understand and apply Tanner's framework to clinical reasoning, because even though it's titled a clinical judgment model, it's a reasoning. Each of these processes of noticing, interpreting, responding, reflecting, or the NCSBN equivalents, are all processes or steps that will get you step by step to the outcome of the right judgment. So a noticing skill that we want to develop in our students that is in this category here, and I talk about it at length in this chapter, is that are your students able to notice correctly by systematically reviewing the medical record, using a report sheet to organize patient care. This is why our report sheets need to be simple, but we also need to guide our students to navigate the electronic health record in most settings. And if they struggle to navigate and get proficient with navigating the medical record, making sure that they are accurately getting the information they need from that medical record, they will not notice because they'll miss data from the medical record as they collect on their patient. Or when they're getting report, for example, that's another aspect where noticing is used. The ability to also identify the essence of the patient's story, by just simply in one sentence, being able to simply concisely state what is the essence of their problem, the day of admission, their post-op day 2 for an appendectomy. Simple. That is going to come when they effectively navigate the medical record. And are they able to carry out focused patient and room assessments? When you do an assessment, the first step of nursing process, you're also noticing and recognizing what's most important or what's unexpected. And so again, that's why having a fluent head-to-toe assessment is going to facilitate and strengthen noticing skills. That's the first clinical reasoning skill. And it's the very first step that Next Gen will use in their case-based scenarios because it aligns with recognized cues. In essence, it's the same thing, just saying it differently. But Tanner's gives you a much kind of a broader picture, encourage you to read that theoretical framework. So those clinical skills we want to develop in our students in clinical as much as possible, because this is where it all begins. And so I want you to see that and put that together. And so as you look at your clinical paperwork, do you have competencies? Because these clinical skills are in essence clinical competencies of clinical reasoning. Can they review the medical record systematically and concisely? Can they identify the essence of a patient's story if you were to ask them why they're patients in the setting? Can they do a fluent head-to-toe assessment and not obsess for, and do it in less than 5 minutes? That's our goal with our students, especially as they progress. As we look at the next category of thinking skills, we want to recognize that there are clinical skills that they need to demonstrate, but that clinical reasoning is in essence a cognitive thinking skill. And there's kind of what as I looked at noticing a little deeper and thought about it from my lens of practice, there are really 2 levels of noticing that we want to recognize and develop. One of them is fundamental, one of them is advanced. And so the basic fundamental skill that we want to develop in our first semester students is, do they notice from the medical record, from report, from the lab values, the vital signs, the assessment data they collect, can they notice what is significant or most important in those situations? So for example, noticing a fever of 103, that's good. And that's a starting point. And so that's, abnormal data that stands out is typically pretty easy to notice. But again, the next step of Tanner that we're going to talk about next time is interpreting. What does it mean? So noticing is where it all begins, but then the nurse needs to interpret the significance or the meaning. That's for another time because we're going to focus on noticing. So noticing what's kind of abnormal, like abnormal labs that are significant or way off, looking at a heart rate that's too high, a blood pressure too low, etc. Those are relatively straightforward to notice. So it's a fundamental skill. We want to make sure that our fundamental students are able to notice and recognize what's most important. And even in the Next Gen uses the same language of, what clinical data is most important to the nurse. Same thing. The advanced skill of noticing is the ability to distinguish between what is expected and unexpected. And again, the Next Gen is going to use that same question, but it's also a noticing question because it takes clinical experience. This is why there's no substitute for getting that clinical experience, because a student, to develop the nuanced ability To recognize what's expected or unexpected comes from experience. And it's not going to come from, anything less than the real world settings. Simulation, good case study can do that. But the bottom line is that we really need to recognize that this ability to distinguish between expected and unexpected comes from experience. So therefore, it's too high a bar for a fundamental first semester student. But if you're teaching third and fourth semester students that are close to graduation, that have had experience, hopefully, now that we've got COVID behind us for the moment, the bottom line is the ability to distinguish between expected and unexpected is another noticing skill that we want to verbalize. And we can actually do this by simply asking the right questions. So for example, I've got 4 simple noticing questions that we can ask our students every time in clinical. For example, in one sentence, describe the essence of your patient's story. Second question, what is the primary problem for your patient? Summarize that using the pathophysiology in your own words. You see, can they take the knowledge of the problem, understand what's going on? Can they understand, like, for example, what sepsis is if their patient has an infection and is septic or has any other problem? Third question, what findings did you notice that are most important? That's a really good question to ask any student in clinical, as well as what did you notice that is different than expected? And so again, these are simple questions that we can ask every clinical as it relates to developing the noticing skill of clinical reasoning. And one strategy that we can do as nurse educators is that we can take each construct of clinical reasoning, starting with noticing and assessment, how those align together. And we can basically focus our clinical on that day, dedicating it to noticing what's most important or what is expected or unexpected with your patient in the medical record and what that looks like. And so I just want to kind of give you a sense of just, some of the things that we can develop and do as educators. And what I do in this chapter is that I just kind of go deep and I kind of, have a lot of icons and some very salient action points about, how they can apply this and use this in practice. And so I've got a lot of practice pearls from my own lens of practice, clinical red flags for students to be aware of. You even have a little chart here on vital signs to facilitate noticing. And I looked at some of the early warning scales, the Muse and others that are used to assess problem recognition, and kind of synthesize them to kind of look at, okay, a respiratory rate for an adult, 12 to 18 is your normal. But 9 to 11 is concerning, less than 8 is a red flag, and possible reasons why. Or if they're tachypneic, what that range is, over 30 is a red flag, and what those represent, etc. And so I kind of looked at the vital signs. This is a very practical worksheet that your students could use as just a guide to kind of say what's normal. That's not concerning. But what is concerning are these ranges, and what are red flags are in the other column, as well as possible problems. Because one of the things that our students are going to be doing for next gen, if you got abnormal data, what does it mean? What are some of the problems this data suggests? And so I focused on that, not so much for next gen, because I wanted my students to basically have enhanced problem recognition skills in what that looks like. And so I just kind of wanted to highlight those pieces and have some guidelines on a room assessment. And just, again, when you step into the room, how we can teach our students to do a 15-second assessment of their room. Make sure it's safe. What do we need to check? Making sure their oxygen flow meter is what was in report. Is the oxygen tubing connected to the flow meter? You'd be surprised. Sometimes it's not, or it appears to be, and it's very loose. And so I just kind of take some of the pearls from practice that I've experienced, looking at the IV side of the patient, looking at all your tubes, and just, again, some practical guidelines to just really help our students notice what's most important, put it all together. And what I'd like to do before I go into the application activity is just essentially just wanted to go into the chat and see what questions do you have as it relates to noticing and what I've shared today. And as you look at some of these principles here, I just kind of want to look at the most recent comments here. And so as we look at this, Katie asked the question, does your book discuss what to do if and when your student notices a negative trend and the assigned nurse doesn't care or act? What I do talk about, Katie, is the importance of trending under interpreting in the next chapter, because that trending is essential to recognize where your direction of where your patient's going. And so that is discussed in a later chapter to answer your questions and what that looks like. And Katie asked the question of, considered removing words like essence for our ESL nurses who don't have a diverse English vocabulary, exploring more diversity, equity, inclusion concepts to engage diverse nurses to succeed and thrive. Katie, I'd love to know your thoughts as far as what you'd suggest, and if you have any other verbiage, because I'm glad to consider that as I look at just how I communicate that and what that looks like. Destiny has a question. She says, do you believe the traditional care plans for clinical are beneficial for students as they prepare for next gen NCLEX? And it depends on the care plans, Destiny, but I would say this is that care planning needs to be simplified. And really, when you look at a clinical reasoning skill, for example, of priority setting, if we're asking our students as they notice and then interpret the clinical data in the medical record, in report, in their own assessment, you have to make then, as you notice what's most important, you interpret the meaning, then the next item, the next reasoning skill is responding. And that's where you start to develop your nursing priority. So again, if they can understand and put the essence of the nursing priority in their own words or using NANDO when it fits, that's a starting point. What's the priority intervention or 2 or 3 interventions that must be done as soon as possible? Prioritization is always a clinical reasoning skill. Knowing the rationale for your intervention and knowing the expected outcome are all essential. And so what I would say, Destiny, is that yes, care planning is essential because you need to have that nursing priority, and next gen NCLEX as well as practice demands that you need to put it all together to recognize what is that priority? What do I need to do first? Why am I doing it? What is the expected outcome? Those 4 pieces of care planning is the essence of what our students need to know. They don't need a 5 or 10 page care plan that goes deep in the weeds with 3-part NANDA statements. That is not necessary. And we've got to let go of that. If we're still holding on to that, some of us still are, because it's not how a nurse thinks. And NCLEX hasn't used NANDA verbiage for years. And next gen is all about, can they recognize what the problem is, what they need to do, and why they're going to do it? And if it's expected or unexpected. This is when, if you know what the outcome of your interventions will be, what should happen if the patient responds appropriately, then you're going to be in a very good place to make that little 3-column matrix or 2-column matrix of, is it expected, unexpected, if you know what the expected outcomes are. So again, these are practice principles, Destiny. I hope you found that helpful, but that would be my answer to a very important question. So thank you so much for asking that. And so let me go to the next question. Megan has a wonderful question. Am I the only one struggling with the overlap in defining clinical judgment, clinical reasoning, and critical thinking? And Megan, it's not just you. And, I think that, I'm going to make it really simple and just kind of maybe try to put these constructs together. They are complementary, but distinct. And they are not synonyms, by the way. Some people will say, oh, critical thinking, we did that 10 years ago in nursing education. Now it's clinical reasoning. Now it's clinical judgment. It's all the same, just a different verbiage. Not true. Now, what I shared at the beginning, I hope would clarify that, because critical thinking is, again, there's critical thinking skills, but if you want to keep it really simple, like I try to do as I teach and do what I do with nurse educators, do they understand your content? Can they apply their knowledge to a patient scenario? Critical thinking is that ability to understand the knowledge. That's the essence. Now, are there more definitions of critical thinking? Absolutely. There's over 60 in the nursing literature. But do they understand their content? The reasoning is that thinking in action at the bedside of patient care. And again, that ability to think on your feet is another way to look at clinical reasoning. Can you kind of like say, oh, I had this wonderful plan of care, but now my temp's 103. Now what's my priority? Now what do I do? Oh, and my blood pressure has dropped 30 points systolically. What's my heart rate? It's gone up 20 points since the last vital sign. Can they recognize the significance and put that together? And then clinical judgment is simply the outcome, the decision that is ultimately made. So you reason step by step to the judgment. And so, Megan, I hope you found that helpful. And if you have further questions, please email me and this is true for all of you. If any of you have any questions or anything that is just kind of a splinter in your brain, just email me at keith@keithrn.com. It's right there on the screen. And I'm available to serve your needs with any questions or splinters that were not resolved in our time together here today. So good. Well, if you're saying thank you, I'm glad you found it helpful and in putting that together. Megan has one more question. She says, also, many of our students have limited access to the emergency medical record in clinical. How can we expect them to navigate the chart, document appropriately if they don't get the opportunity? That is a big problem, Megan. I don't understand that because our students are going to be nurses in practice soon. They need to get their hands on the documents. And I know that institutions have policies, but they're shooting themselves in the foot. And I would just try to work and try to be proactive, working with the institution to see if they could change that, because it's well intended, but it's actually harming the development of our students to really embrace the scope of practice, what they need to know, and how to use the tools. You know, you cannot just read about it or watch it. You've got to do it. You know, ultimately, kinesthetic learning is what makes it stick when you really put it together. And so, unfortunately, I know that all too many institutions do not let students have the access to the medical record they need to be nurses. I don't understand that, but I hope we can change that culture in our practice settings as we can work together. You know, this is where we as educators in practice, boy, we've got a lot of work to do, but we really need to work together and put that together. So anyways, great questions. And thank you so much. I'm just going to kind of close with an application activity that closes the chapter and see how you do as an educator with this as we look at the noticing skill. And so let me just kind of share my screen one last time and what that looks like. And so let's go into this activity and let me just share my screen with y'all and go from there. And so in this scenario, you know, I always within the textbook, my goal is to really make the learning stick by saying, okay, we've talked about noticing, we've talked about the questions, we've talked about the ways. Let's make it stick with a practice-based scenario, which again is educational best practice. And so in this case, it's very short and concise. Zanae Young is a 9-year-old African-American girl who presents to the emergency department after the school nurse called her mother. Zanae has a history of moderate persistent asthma and was diagnosed at age 6 and has had 2 prior hospitalizations for asthma, with 1 admission to the pediatric intensive care unit. Zanae started complaining of chest tightness and feeling winded after recess today. She is alert, sitting upright, speaking in short sentences with an O2 sat of 91% on room air. She complains of increased chest tightness and uses her accessory chest muscles to breathe. She has coarse expiratory wheezes throughout both lung fields with decreased breath sounds at the left base. Moderate intercostal and substernal retractions are noted, and she appears anxious. Before entering the room for the first time, you review the complete set of vital signs, which are right here. And she's afebrile. Her rate is 30, 115 over 70, 91% room air. And so again, as we look at this data, let me just kind of shrink the screen just a little bit here. We want to pause and ask our students, what are you noticing that is most important or unexpected in this situation? I would say most important. I would focus on most important here. And as we look at this, she has a history of asthma. She's sitting upright, short sentences. What does that tell you about her ability to breathe? That's all relevant. Her O2 sat is too low. She's using her accessory muscles. She has coarse wheezes with diminished breath sounds and retractions. Her vital signs are showing that she's in distress. Her SATs are too low. Her rate is too high. She's not running a fever. So a likely source of infection, whether it be any upper respiratory infection, viral or bacterial, is likely not the cause of her exacerbation. And so again, what are you noticing? We're not going into what it means quite yet, but you can see that in order to interpret the data in this scenario, in any practice scenario, you need to have that ability to first notice it, apply your patho to know what it means. So now we look at some lab values. And now we can see that our current CBC results are right here in this section. Doesn't look too bad. Our neutrophils are normal. Our white count is within range. We look at our metabolic panel, and we can see that in essence, compared to 3 months ago, we're looking pretty good. Her chest x-ray, though, has hyperexpansion of airways. And again, what does that mean? Do you need to notice that? It's just telling us that our airways have got that chronic hyperexpansion, most likely from her history of asthma. And so again, we can take the 4 steps or the 4 questions of noticing that I asked at the very beginning of this chapter and saying, okay, what is the essence of this patient's story? And when you use the essence or whatever verbiage you choose to use, you're really kind of wanting to also, the essence of the story is also the essence of the nursing priority. This patient is a 9-year-old asthmatic who is struggling to breathe. You can use impaired gas exchange if you want to use NANDA, but if you want to just keep it simple to how a nurse thinks in the real world, I didn't think NANDA, even though I knew NANDA as a nurse in its infancy when NANDA was first introduced in the early 80s and I graduated in 83. I didn't think NANDA. But I could recognize, this patient is in distress, respiratory distress. That also aligns with the priority in what you're going to do. So again, if you know asthma, what's the pathophysiology of asthma? What's going on in the airways at the bronchial level? What's going on? Why is she having wheezing? There's a connection there when they understand their patho. What findings do you notice that are most important? And again, we talked about that already. And then the 4th question in this scenario, what do you notice that is different than expected? As you look at this scenario, is there anything that was unexpected? The lab values were all within normal range. Depending on what your assumptions were, you can think that, there might be an upper respiratory or viral infection or bacterial. I'm not going to put that on my problem list. I think this is just a pure asthmatic exacerbation. Let's open up her airways with albuterol, a nebulizer, and let's really watch this patient. This patient is critical. And again, recognizing the urgency of what's taking place there. And I always end with with an action point. I want students to use this chapter and everything in the book to write in the margins. These margins are about 3 inches wide for a reason. I want them to write what they learned. What was new to you from this chapter, from this scenario? And then finally, pause and reflect. How will you apply what you learned in this scenario and in this chapter to improve clinical decision-making as you care for future patients? Write the answers in the margin of the book. And then the next chapter, we're going to talk about the noticing skill, or actually the interpreting skill of clinical reasoning. And so that's the chapter of interpreting, of noticing, and what that looks like. And I hope you found that helpful. And I'd just like to know, what questions do some of you have as you look at this? And, some of you are basically, had some questions earlier on and I missed it and I apologize for that. is that you wanted to know if these books are available in an ebook. And I want you to know that, yes, they will be in June 1st. I just got them published, and they'll become as an ebook and an audiobook bundle that will be available. And it's an electronic download, and it's very simple to work. And so that's going to be available after June 1st. And so just be looking for that. If you subscribe to my email updates, that information will be there. And so I just want you to know that. And so just would like to know what other questions or comments anybody has as it relates to what we've talked about today. And so as you look at, Pauline asked the question, what book of yours should I order for Peds OB? What I want you to know, and let me just I can kind of quickly highlight, Volume 1 is a foundations text. They're like about 180 pages. And this one talks about student success, 3 chapters on student success, and then goes deep in the weeds on holistic care, professional behavior, and, the importance of caring and compassion, and then civility, that Dr. Cindy Clark reviewed that chapter. So the books are basically meant to provide a overall practice-based perspective for any content in your program. And so this is for foundations, laying that foundations. Volume 2 is building the knowledge base for professional practice. And again, it's the 6 chapters, 180 pages, where I really go deep on the most important pathophysiology concepts and looking at practice-based assessment, looking at pharmacology, fluids and electrolytes, the applied sciences of what's most important. And again, bringing a general global piece. It's not meant to necessarily teach a specialty topic or even pharmacology. What I've done with this textbook series is to highlight for students and for educators as well what content is most important to practice, and then providing a practice-based perspective, using the pearls of myself and other authors and contributors who I've been blessed to have review, because I couldn't do this project alone, who are sharing their pearls. And so it's immersed in practice. And one of the weaknesses, I think, in nursing education is that textbook learning is decontextualized. It's just information. It doesn't show students how a nurse uses it in practice. And so I just created this 3-volume set with the caring, the ethical professional behavior, the highlighting the knowledge of practice, and then clinical judgment, and going deep on the reasoning skills, step by step, using Tanner's framework as my organizing structure that aligns with Next Gen. I also have content on Next Gen. And so I have been blessed to have educators. I've been blessed to, have a lot of interest in the book. And I want to share just a couple links for you. And just want you to know that, one dean who at Missouri Baptist University, Dr. Amber Pyatt, she saw the book at a conference. And she wrote me this email and said, we've been looking at better ways to incorporate clinical judgment into our curriculum. We've incorporated it, but we didn't have a textbook that felt like a good fit. As soon as I saw Volume 3, I knew it was what we were missing. Our students can use it in the classroom, and we plan to have it implemented in the clinical setting as well. The book will allow all of our faculty and students to be on the same page. And I've just been humbled by that and other comments, because I know that I'm striking a nerve, and it's a book that is meant for students. Let me be very clear about that. But yet, like other books I've written that bring a practice-based perspective, educators will benefit from it, and just want you to know that it's a resource that can help you. And so if you're interested, let me just share the link to the book, and to just, if you'd like to learn more, I have the best pricing possible right now until the end of the month. And so it's going to go up about $30 for the bundle, and it can also be purchased individually after June 1st. Right now, it's just a 3-volume bundle because I want educators to really have access to this resource first. not promoting it to students right now, and consider it for adoption in the fall or at some point in the future. It's a very practical and very easy to use resource with a lot of application and bringing practice. And again, kind of that mantra of putting practice first within your program is really the overriding paradigm that these textbooks bring to your program. And I also have an integration map I've got an Amazon S3 link that shows how each chapter aligns with key content in your curriculum, with the courses that are common in your traditional PN or RN programs. And so I want you to take a look at that, and you can kind of begin to put two and two together and see what you think. And if there's anybody, I'm not at all that aggressive. And if you're interested in just looking at adoption, just want to know, what would be the best possible price? What would this textbook be in the ebook version versus the paper book? The paper book version for students is going to come at one price point, and it's reasonable for the paper version, and the ebook and audiobook will be included at no additional cost. And then there's a lower price point for the ebook, audiobook only. And so I just want you to know that. And if you'd like to learn more, again, just fill out that form, and I'll have someone follow up with you. And so other than that, I just want you to know that in 2 weeks, we'll kind of dig deep on interpreting skills. I hope you found this helpful, and again, as you just look at developing the noticing skills of clinical reasoning, knowing that as you just incorporate them into questions, break it down into specific skills, and then be able to basically kind of like competencies. There are competencies of clinical judgment that represent these skills that I mentioned about the skills of navigating the electronic record, of assessment, identifying the essence of the problem of your patient. And so again, putting that all together. And so we'll do that in a couple of weeks. If you have any questions of anything that I've shared today, do not hesitate to reach out. And my email is right here. And I just want to thank you for your time today. And I also just want to let you know one more thing, that if you are interested in my departmental membership, I've got a resource that's called Think Like a Nurse, and it has access to over 110 tools. It also has access to 110 case study topics, I should say, that are all of my unfolding topics that I've written over the last few years. But I've got other topics that are coming it's in the process of being revised and updated as well. And I just want you to know that if you're looking for those active learning resources, I've got those covered for you. And here's just a link to the membership if you just like to learn more and what that looks like. And so I see we got some collaborating going on here in the chat. I love it. And again, the Facebook group is available to you all as a resource, the Entrepreneur group. And again, don't hesitate to reach out if you have any questions or anything that I can do to best serve your needs in nursing education. So again, it's been a pleasure. Thank you for taking time out of your busy schedule to join me tonight. And we'll see you in 2 weeks as we talk about interpreting skills and how we can strengthen and develop that in our students step by step. So thanks so much. God bless. And have a blessed and a restful summer, because we all need restoration. And what's the root word of restoration? 4 letters, R-E-S-T. I need to preach that to myself because I find it hard to just slow it down a notch, but I know it's so important. I hope you're getting that rest that you need, because we got to go at the speed of soul. And that means we have to go slow. And so get the rest you need, get tanked up, allow yourself to get replenished, fill the tank, and you're making a difference. And it's really a pleasure to partner with you, to provide you with the tools, the strategies to put that gas in your tank, some strategies in your tank, be the needed change. And you're right where you need to be for a reason. And thank you for all that you're doing to make a difference. Take care and have a great week.